Hi everyone, my name is Wendi Kohler. I'm a natural health advocate, a doctor of physical therapy, and an essential oil specialist. And I wanted to thank you for following along with our Essential Support series. Our intention is to bring you simple, practical steps that you can take care of your health today and every day, not just through the pandemic. So I believe that right now we're all experiencing the opportunity and an invitation to take a look at our lifestyles through the lens of health and ask ourselves, how can we take that next best step for our own health and our everyday wellness? Today, I've got with me Dr. Leah Lawson, and our focus will be on movement and how that's going to benefit you with what you're going through right now. It's so tempting to stay on our couches, but there are a lot of reasons why we should get moving. Dr. Leah treats patients at Vitality Health here in Barrie, Ontario, and at Bayside Wellness in Collingwood. She's passionate about getting you back to where you want to be in your health so that you can do the things that you love. She's a chiropractor that also has additional training in soft tissue therapy, including cupping, acupuncture, and functional taping. And Dr. Leah walks the walk. It's one of my favorite things about her. She actually lives the healthy lifestyle that she talks about. So in her spare time, when we're not in the pandemic, she plays hockey, she watches hockey, and she even referees it in the winter months. And in the summer, she participates in triathlons. Dr. Leah, thank you so much for coming on with me today. As an expert in the field of movement and the body, can you give us some information on what we can be doing right now, and most importantly, why that's good for us right now?
Yeah, so thank you for having me, Wendi. I'm excited to be here talking to you about this. It's definitely something I am passionate about, and definitely within the last couple weeks, noticing that because people are stuck at home with social distancing or physical distancing, as well as their usual recreational activities such as, hockey, like we mentioned, or dance. I know your girls are in dance, or even stuff like judo, that kind of stuff, has all been canceled. So our usual outlets for recreational activity aren't there anymore, which is leading us to be a little bit more sedentary than I think all of us would like.
Yeah, for sure. And that's going to lead to a lot of different health issues and ailments after all this, isn't it?
Yeah, so movement for the body is basically its way of healing itself. So when we move our joints and our muscles, that creates an increase in blood flow to those tissues. The increase in blood flow increases the oxygen to those tissues, which is basically what allows those tissues to thrive. And if you're not getting that increase in blood flow, it's going to create a lot of that pain and stiffness that I'm sure a lot of people have been feeling that increase of over the last few weeks.
Absolutely. Yeah. When we're not moving, we get more stiff and sore. And sometimes, even me personally, I'm doing less movement and I feel stiffer and sore, almost like I've worked out, but I haven't. And then I get this sluggish feeling in my emotions and my body.
Definitely.
And it leads to this whole other like emotional realm when I'm not moving as much as I know I should be, especially in times of stress.
Definitely. So exactly what you said. I love that you brought in the emotional component to it as well. So our brain is one of those things that needs that oxygen flow as well. And if you're not moving and providing a fresh supply of oxygen to your brain, you're going to often feel that mental stiffness or that fogginess or, sometimes frustration or all that type of things. And especially now in this more stressful time, our body and our brains crave that nourishment of that oxygen and increased blood flow. So the easiest way for me to, encourage movement in this time is telling people to get out, especially on beautiful spring days, get out and just walking around their block, right? So social distancing or physical distancing doesn't mean that you can't leave your house. Just if you do see someone else that's not part of your household, make sure you have a 6-meter buffer around you, right? Moving down to the sidewalk or the road or the other side of the road or that kind of thing. But just moving around, walking around your block is going to be the best thing that you can do for yourself during this time, and to get that movement back in your body and the blood flow back to that brain as well.
And it doesn't cost anything.
No, nothing at all.
You don't need expensive equipment or, yeah, it's free.
It is pretty, yeah. So as we're sitting, at our makeshift home desks, you're often going to find that you're going to have an increase in pain, usually in your low back or neck and headaches. And just scheduling yourself some time to get up and move. So we really don't want to be sitting at that desk for more than 30 to 50 minutes at a time. So that doesn't mean that every 50 minutes you have to go for a walk. It does mean that you should be getting up and doing a lap or two around your living room if you can, right? And then back to work. And then even if you get a lunch break, that would be a great time to go for that, maybe a little bit longer walk outside as you're able to.
Yeah, a few strategies that I've put in place during this time, and that they also incorporate, because I do work from home. My office is in my home, and so I set my Fitbit for every hour, and if I haven't fulfilled a certain number of steps, it reminds me.
Yeah.
So you can simply set timers on your phone, or literally like an egg timer that we used to use, to encourage you to do that. And even if I'm like, oh, I'm short on time, I'll literally run up and down the stairs a couple of times. Another little quick strategy is walking meetings. So if you have to have a meeting with someone, we'll just get on the earphones together, take our walk, as long as we don't have to show anything on the screen. And that can be a way to do the double, goodness in your day.
Exactly. Or even just, I know a lot of people are checking in on their family members more via, phone calls or video chats or that. And you can definitely do those walking as well, right? So it's a great way to spend your time moving is talking to your loved ones as well.
Absolutely. Lots of extra bonuses there. So as a chiropractor, and my husband is too, and like we already anticipate what we're going to see influx of after all of this is done. Like, what do you think you're going to see the most of?
Yeah, so I think what the most thing that we're going to see is an increase in low back pain. So because we are sitting more, especially in maybe not the perfect posture, but a slouched posture. Yes, just like that. That sitting motion bent forward more is putting more stress on those intervertebral discs. So those little donut-y cushions in between of your vertebrae. If you've had any previous disc injury, it's likely that it's going to get a little bit more sore if you are increased in sitting. So I think this is going to be the biggest thing that we see after the whole pandemic.
So we're sitting a lot during the day more, we're slouching more on the couch to binge watch Netflix at night. It's such a bad position for your spine overall. And then many of us, like myself included, I love gardening. We're going to go outside and try to clean up our yards. And what's that going to do to us?
Yeah, so I love that. And I encourage that, to get outside, some fresh air, sunshine, some movement, but just be aware that your body does become untrained when you haven't done a certain movement in a long time. So I know we're going to mention some blogs that I have maybe a little bit later, but I think a blog from maybe 2 springs ago, I talked about spring overtraining. And that's basically saying that, as us Canadians get out, as the sun starts shining and temperatures increase, we want to do things the same way we did at the end of the summer or fall. And we have to remind ourselves that our body is no longer trained to do that. So when you're getting out there gardening, I recommend just starting small, right? Starting with the 20 minutes or so to start, and then coming back and seeing how your body feels with that before you go out and try that again. So
yeah, and being really cautious, guys, when you're doing your raking, that you're not doing a ton of twisting. That's such a challenging position for those discs when we've been doing a lot of flexion. And so walking, like we know, can increase extension in your spine, so that can help offset it. All right, so I know when I was reading your blog, and I know you've posted on Instagram, you have a great hip flexor stretch for people that can help with low back pain. Why would we want to stretch? Why would we want to do a stretch like that?
Okay, so our hip flexors, like they say, flex the hip. So when we're in a seated position, they're consistently shortened, since our thigh bone is closer to our abdomen. And it's really important because those hip flexors actually connect to our low back. And that means that we're going to probably have an increase in low back pain when those are tightened. So that's why it's really important for that. Another muscle that's going to be affected by our poor posture is going to be the suboccipital muscles. So they are located at the base of our skull. Yep, and they are going to be tightened when we constantly look down, and instead of bringing our full neck up, we're just kind of shortening those little guys by just bringing the eyes up. So a great stretch for this is going to be the chin tuck stretch. And that is basically just moving your chin straight backwards and giving yourself a double chin, just like Wendi demonstrated there. And it's even better from the side. So you can see she just brings her chin right back, and that's called the chin tuck stretch.
It feels so good.
So good. So we want to make sure that our chin isn't tucking forward or back while we're doing this stretch. That's like the most common error that I would say that people do. So just make sure if you're doing it in a mirror, the eyes stay level, chin stays level, and you're just pushing that chin right back. I hold for just like 3 to 5 seconds, even doing it 5 times in a row. Even that small start, simple start is going to help.
Yeah, great. Yeah, and we can incorporate that easily within our day. So that's an amazing tip too. Okay, that's so helpful. So we want to stay active, even just doing simple things like walking. We want to remember not to just jump right back into our gardening. We want to remember that our bodies aren't necessarily exactly trained for that. Get outside. Think about your posture when you're sitting. Think about doing some chin tucks to help you prevent headaches and neck pain with all this, and just be aware. So those are all easy things that we can implement. So really grateful for your tips there. I would say my additions to this from an essential oil and a physiotherapy aspect are that we can use some essential oils for pain reduction and to decrease the inflammatory response in the body. So different ones we use here in our practice and every day at home. We have a 1 liter pump of Deep Blue, but simply just adding this onto sore muscles or sore joints can help reduce discomfort. So that's an easy tip when we can't get in to see our physio and our chiropractor and all of our health and wellness practitioners, that we can be doing ongoing to help support our bodies, as well as moving. Like, it's a big piece of wellness. So that's just something. Two other oils that I love, especially after my concussion, are cooped and frankincense. And Dr. Leah has helped me through my concussion healing process. And in times like this, where I'm on the computer a lot more lately with doing a lot more online teaching, I notice now that I haven't been getting my acupuncture and as many adjustments that at the end of the day, I get a little bit tired. But cooped is an essential oil that helps in a healthy inflammatory response. And on a wellness perspective, it's good to take every single day, 1 to 2 drops under your tongue twice a day. That's what I would tell anyone to do. And so I'll just show you exactly how to take it. Like that. Or if you're someone who struggles with headache, head tension, or like me, you wanted to use it as part of a recovery, then you can put a little drop on your thumb like this. And this is called a thumb press. And you take that little bit on your thumb and press it against the roof of your mouth. Like that. And you can do that with frankincense as well. And then I would take the excess and just rub on the back of my neck, or the bottoms of my feet is another great place where you can topically apply essential oils and get a full body response, or get the oils into your bloodstream to impact the body in general. So those are three oils that I would use consistently on for discomfort in the body and pain and inflammation. So just some tips for you guys if you are essential oil users. And when I'm talking about internal use, I'm only talking about the doTERRA product lines. I'm not speaking of any other brand at this time. So yeah, I think that those are really great tips for us all to keep in mind. And I'm so grateful for you joining us here on our Essential Support series. You guys, it'd be great if you would check out more of Dr. Leah's content on Instagram. You can follow her at Dr. Leah Lawson, and I'll put the links in the post for this. You can check out her blog on her website too, drleahlawson.com. And as always, I'd love if you'd follow me on YouTube and Instagram as well. If you like the content, please feel free to share it with others. Our intention is to help everyone through this whole process. So thanks everyone, and we will see you next time.
Thanks, guys.